COVID cases nearing all-time highs in California. Governor Newsom is hoping to fight the surge with nearly $3 billion. It's a big part of his budget proposal, which he's going to unveil tomorrow. KCRA3's Aaron Heff joins us live now from the state capitol with a look at what the governor plans to do with all of that money. Aaron, good morning.
Good morning, Leticia. The $2.7 billion is intended to help fight COVID. They say their administration calling it historic and exciting, the largest package in the nation. They say these dollars are intended to help vaccine efforts and help if any other COVID surges come our way. The $2.7 billion are intended to ramp up testing efforts along with testing the proposed the proposed package is intended to boost vaccination numbers, including boosters in both adults and children. Along with that, some of the funds will go to support surge staffing at hospitals and fight misinformation about COVID and its vaccines. Another big ticket item proposed, a new supplemental sick leave policy. The package aiming to work with the legislature for more time, especially for frontline workers. This as California deploys the National Guard to OptumServe testing sites to help expand capacity. $1.4 billion in the package is for immediate action, and FEMA reimbursement may actually help fund some of these efforts. The administration explaining that they've already spent $11 billion in the last 2 years to help save countless lives. They say they want to continue that action. They also say that this full package will be unveiled here tomorrow. At the Capitol, Aaron Heft, KCRA 3 News.
Aaron, thank you. And Aaron mentioned that some of that money will go to increased testing. KCRA3's Orko Manna explains how some COVID-19 testing sites in the community hope it will help them.
COVID-19 tests are in high demand across California. Just this past week, the state saw upwards of 500,000 tests administered in a single day. Staff at the Sacramento LGBT Community Center is witnessing this firsthand at its 2 testing sites.
With the recent surge of cases, kind of with the Omicron variant, we've definitely seen an uptick in the number of folks who are trying to get tested.
The organization offers both PCR and rapid antigen tests, but some supplies are running short.
Currently, for the past few weeks, we've only been able to offer PCR testing.
But they're hoping Governor Gavin Newsom's proposed COVID-19 emergency response package will help. The governor's administration calling it historic and exciting. The package calls for $2.7 billion in funding, with $1.2 billion of that specifically proposed to help bolster testing. That includes distributing millions of antigen tests to local health departments, schools, and community clinics, such as the ones run by the Sacramento LGBT Community Center.
It's definitely going to be a huge help in order to ensure that we're able to continue providing this resource to community members and really help keep Sacramento County safe during these times.
The center tells KCRA3 more resources are especially crucial because they're providing these COVID tests free of charge.
As a community-based organization, we really are looking to break down any barriers that community members may have to getting tested.
Orko Manna, KCRA 3 News.
And the Biden administration is set to give out $500 million rapid COVID tests across the country. The White House says it will get the first batch of tests from the manufacturers in the next week. And that's when a website is expected to launch where people can go and order the test kits themselves. Starting next Saturday, private insurance companies will be required to cover the cost of those at-home testing kits bought on store or online. Governor Newsom has signed an executive order to prevent price gouging for at-home COVID-19 test kits. It prohibits price increases by 10%. And here's a look at the numbers. Along with the big jump in Californians getting tested comes a big jump in the numbers coming back positive. More than 21% of people getting tested right now are testing positive. 103,000 new cases were reported in California on Thursday alone. Now here's a look at the number of cases since the beginning of the pandemic. You can see the surge of cases right now surpasses what we experienced this time last year. Hospitalizations are seeing an increase as well. The number of people getting treated for the virus has almost tripled just in the last month. 9,200 people are in the hospital right now. They have tested positive for COVID. Looking at hospital numbers since the beginning of the pandemic, you can see the rise in hospitalizations is still far below what we experienced this time last year, when hospitalizations peaked around 21,000 patients. Some school districts in parts of the country are returning to remote learning as the Omicron variant of COVID-19 spreads rapidly in their communities. Meanwhile, the new federal data is sorting out the data and the high number of hospitalizations among children. KCRA3's Christopher Salas is live in Washington right now with the impact and reaction. Christopher, good morning.
Leticia, good morning. Yeah, so children are still the least likely to be hospitalized compared to any other age group. But right now, pediatric hospitalizations are at the highest rate compared to any other time in the pandemic.
A surge in COVID-19 hospitalizations among children. New CDC data from this past week shows a record level, nearly 800 children hospitalized a day, 4 times higher than 2 weeks earlier.
The pediatric rise probably has a lot to do with the variant being more contagious, in addition to the circumstances we put the children in, such as the holidays and so forth.
The head of the CDC says despite the increase, it's unclear if the variant is causing more severe disease.
We are seeing a rise in hospitalizations, both because they are coming in with COVID, but also because they're screening in for COVID.
The rise in cases and hospitalizations prompting thousands of schools to close their doors across the country.
We must keep our schools open. They are essential. They are not nice to have. They are must-haves.
Chicago's teachers union is one of several across the country protesting in-person learning.
The city has failed to deliver a whole number of basic demands that we need in the schools.
The White House is pushing districts to use federal stimulus money to keep schools open.
I encourage the states and school districts to use the funding that you still have to protect your children and keep the schools open.
New data from the CDC released on Friday shows unvaccinated children are 11 times more likely to be hospitalized with COVID compared to vaccinated children. As for those kids who are still too young to get a vaccine, the CDC says the best way to protect them is to make sure everyone around them is vaccinated. Leticia.
And Christopher, can you talk a little bit more this morning about the new guidance from the CDC regarding slowing the spread in schools?
Yeah, so the CDC says when it comes to unvaccinated children who have been exposed to the virus, not necessarily if they test positive or not, they should quarantine for at least 5 days. Then when it comes to students, teachers, or staff who get infected with COVID, they should quarantine for a full 5 days, then wear masks 5 days after that when they're back in school. And then when it comes to extracurricular activities and sporting events, the agency advises that those be moved to virtual and the best effort that school districts can, or cancel them altogether in communities where transmission is high. Leticia.
Thank you so much, Christopher. It's important to remember that the CDC says this is typically a time of year when children are ending up in the hospital for various types of illnesses. And since everyone has to be tested for COVID-19, that may not be the reason that they went to the hospital in the first place.